Hey, happy Movember. Yes, changing the face of men's health. That's what Movember is all about. So in that theme, let's talk about prostate cancer. What should we know about prostate cancer is that we need to get screened. Yes, despite some of the confusion and the controversy, what we now know is that if we screen, we reduce prostate cancer related deaths. So what we need to the bottom line when you look through all the data is that when we screen for prostate cancer, which is with a PSA blood test, we reduce deaths from prostate cancer. We also diagnose more prostate cancer. And yes, it's true that not all prostate cancer needs to be treated. So this is really important. So get screened, talk with your doctor if you are 50 years old or older. If you have risk factors, what are the risk factors? If you're African American, or if you have a strong family history, you should probably have this conversation about when you should start screening at age 40 to 45 based on the AUA guidelines or the American Cancer Society guidelines. United States Preventive Task Force, not quite there yet, but overall it is important to get screened, but it's also important that everyone should not be treated and that we know who are those people that need to get treated. So if you're screened and you have a positive PSA, what should you do next? You should repeat the PSA. There are things that can make your PSA go high that might just resolve, like intercourse or riding a bicycle or jostling your prostate or various things like that. So make sure you get it rechecked. When you recheck it, or some down the road, which might be 8 weeks, but if it's super high, then you probably want to recheck it sooner than that. You probably want to check a free or percent free PSA. And if you have higher percent free PSA, meaning non-bound PSA, then that's usually reassuring. But of course, talk to your doctor about what should happen next based on the concern of that follow-up test and when you should be next screened or tested for that. If your percent free is on the lower end, then you might be considering an MRI. You know, of course, you personalize this discussion with your doctor, but an MRI, and then based on the MRI results, decide whether you need a biopsy. So this is a little different than in past times, and so this is kind of where we are now. And then based on the biopsy results, they put you into this scoring system and kind of understand, do you or should you not pursue treatment based on your individual risk? Not everyone should be treated. And in that process, a lot of people should be kind of booted out of the treatment category and into the following and going from their category. So that's the bottom line. However, you know what? Prevention is not the same as early detection. So what can we do to prevent prostate cancer? The top 2 things you can do to prevent prostate cancer are: number 1, don't smoke. That's probably not a shock. Number 2, maintain a healthy body weight. Those are the top things that will likely reduce the likelihood of aggressive prostate cancer that we would die from. But what else is important? We want to support our immune system, right? The immune system is really the thing that is there in control of trying to fight against aberrant, abnormal cells. It is there for that purpose. So we want to support that. So what do we need to do? We need to sleep well. We need to move. And of course, there's foods that have been associated with lower risk of cancer, specifically prostate cancer. What are those foods? Well, if you look at an overview summary physician health study, men who ate a Western diet, what's a Western diet? High in saturated fat, high in processed foods, high in animal products, low in fiber and whole, real plants and vegetables. They had a 250 times percent higher risk of prostate cancer related death. So replace that with fiber-rich, nutrient-rich, anti-inflammatory, immune-boosting foods like cruciferous vegetables like your broccoli, your cauliflower, your kale, things like that. That's a wonderful thing. Lycopene-containing things like tomatoes and watermelon. Those are wonderful sources. Replacing milk products with soy products, both of which in that switch we seem to reduce the risk of prostate cancer. We saw that higher plant food intake was associated with 47% lower risk of prostate cancer progression. So that's pretty cool. So eat your tofu, your edamame, your minimally processed soy products. Eat those tomatoes and those lycopene-rich foods. Those red things often have lycopene in them. Eat your cruciferous vegetables. There's some benefit, it seems, association with coffee and tea, but don't put milk in it because there seems a negative impact from milk or dairy products, particularly high-fat dairy products, processed meats, and processed foods in general. Did you know that the more processed foods we eat, things like cookies and crackers and things like that, the more cancer we get? Yes. So what can we do? We can eat healthy, we can move well, we can love and connect more. And that takes us to that whole Ornish study, which summarizes it all. Move more, stress less, love and connect more, and eat well. Those 4 things showed the slowing of the progression of prostate cancer over 2 years, fewer needs for treatment and progression of prostate cancer, and a reduction in PSA as compared to an increase in PSA with those people that did not do Dr. Dean Ornish's lifestyle medicine program. So I hope this gives you some good power around prostate cancer, and enjoy Movember. Take care.